Welcome to this presentation on the pathways to licensure for international medical graduates in Canada. This session aims to provide a comprehensive overview of the steps, requirements, and considerations for international medical graduates aspiring to practice medicine in Canada. We'll explore the roles of various regulatory bodies, essential examinations, language proficiency requirements, and alternative pathways to licensure. Whether you're an international medical graduate beginning this journey or seeking to understand the process more deeply, this guide will offer valuable insights to help you navigate the Canadian medical licensure landscape. In Canada, the regulation of medical practice is primarily managed by provincial and territorial medical regulatory authorities, MRA. These bodies set the standards for licensure within their respective jurisdictions. The Medical Council of Canada, MCC, plays a pivotal role by assessing and evaluating medical graduates through standardized examinations, contributing to the uniformity of medical qualifications across the country. It's crucial for international medical graduates to familiarize themselves with both the MCC's national standards and the specific requirements of the MRA in the province or territory where they intend to practice, as these can vary significantly. The journey toward medical licensure in Canada for international medical graduates, IMGs, begins with several foundational steps. Firstly, ensure that your medical degree is recognized by Canadian authorities. This typically involves verification through the World Directory of Medical Schools. Language proficiency is another critical component. Demonstrating fluency in English or French is mandatory, as effective communication is essential in medical practice. Additionally, the credential verification process, managed by the MCC, involves submitting your medical education documents for authentication. Completing these initial steps establishes a solid foundation for the subsequent stages of the licensure process. Proficiency in English or French is a non-negotiable requirement for practicing medicine in Canada. Effective communication with patients and healthcare teams is paramount to providing high-quality care. Several standardized language tests are accepted by MRAs to assess proficiency, each with specific benchmarks that candidates must meet or exceed. Achieving the required language proficiency not only fulfills regulatory requirements, but also facilitates smoother professional integration and enhances patient trust and safety. Physiciansapply.ca is the centralized online portal used by the MCC for the verification of medical credentials. Through this platform, IMGs can submit their educational documents, which are then authenticated to ensure their validity. The process involves creating an account, uploading the necessary documents, and following the specified procedures for verification. Accurate and timely submission of credentials is crucial, as any discrepancies or delays can impede progress toward licensure. Utilizing physiciansapply.ca streamlines the verification process and provides a secure method for managing your documents. The MCC QE1 is a comprehensive examination that assesses the medical knowledge and clinical decision-making abilities of candidates. It covers a wide range of content areas, including internal medicine, surgery, pediatrics, obstetrics and gynecology, psychiatry, and population health. The exam is structured to evaluate both theoretical knowledge and the application of that knowledge in clinical scenarios. Preparation is key to success. Numerous resources, such as study guides, practice exams, and preparatory courses, are available to assist candidates in their study efforts. A thorough understanding of the exam format and content will enhance your readiness and confidence. The National Assessment Collaboration NAC examination is designed to assess the clinical skills of IMGs, focusing on their readiness to enter residency programs in Canada. The exam evaluates competencies such as patient interaction, data gathering, diagnosis, and management planning through objective structured clinical examinations, OSCEs. Performance on the NAC examination is a critical factor in the residency matching process and is often required by MRAs for licensure consideration. Adequate preparation, including participation in clinical skills workshops and practice OSCEs, is essential to perform well on this examination. Practice-ready assessment PRA programs offer an alternative pathway to licensure for IMGs who have completed their medical education and possess clinical experience abroad. These programs, available in various provinces, assess the readiness of candidates to practice independently in Canada. Eligibility criteria typically include specific years of postgraduate training and recent clinical practice. The application process involves multiple steps, including assessments and interviews. Successful completion of a PR program can lead to provisional licensure, allowing IMGs to integrate into the Canadian healthcare system, often in underserved areas where their skills are in high demand. Licensure requirements for IMGs can vary significantly between provinces and territories in Canada. Each medical regulatory authority, MRA, sets its own criteria, which may include additional examinations, assessments, or specific training requirements. It's imperative for IMGs to consult the MRA of the province or territory where they intend to practice to understand the specific licensure requirements. Tailoring your pathway to meet these jurisdiction-specific criteria ensures compliance with licensure requirements. The Canadian Resident Matching Service, CARMS, facilitates residency placement for medical graduates in Canada. As an IMG, participation in CARMS is often a key step toward obtaining full licensure. The application process involves submitting exam scores, personal statements, and letters of reference. Strong performance in the MCCQE1 NAC exam and clinical assessments is critical to securing competitive residency positions. Researching programs and tailoring applications to their specific requirements will improve your chances of success. Return of Service ROS agreements are contracts that require IMGs to work in underserved or rural areas for a specified period in exchange for support with licensure or training. These agreements provide valuable opportunities for IMGs to gain practical experience while addressing healthcare shortages in Canada. While fulfilling an ROS obligation can accelerate integration into the healthcare system, candidates must carefully review the terms and obligations to ensure alignment with their career goals. For IMGs awaiting licensure or exploring new opportunities, alternative careers in research, public health, or medical education can be fulfilling pathways. These roles allow you to leverage your medical expertise while contributing to healthcare in different capacities. Pursuing such options can also provide financial stability and professional growth as you work toward fulfilling licensure requirements. It's essential to remain proactive and open to diverse opportunities in the healthcare field. IMGs face several challenges on the road to licensure in Canada, including the financial and time investment required for exams, credential verification, and residency applications. Additionally, adapting to the nuances of the Canadian healthcare system can be daunting, requiring cultural and procedural adjustments. By staying informed, seeking mentorship, and utilizing available resources, IMGs can overcome these barriers and successfully integrate into Canada's healthcare workforce. Canada offers a variety of support resources to assist IMGs in their licensure journey. The MCC and provincial MRAs provide guidance on processes and requirements, while IMG-specific mentorship programs connect candidates with experienced professionals who can offer advice and encouragement. Additionally, financial aid options and exam preparation resources such as workshops and study materials can ease the burden of transitioning into the Canadian medical system. Utilizing these resources can significantly enhance your pathway to licensure. Thank you for participating in this session on Pathways to Licensure for IMGs in Canada. Navigating this process requires determination, preparation, and utilizing the resources available to you. Visit the MCC website for in-depth guidance and support throughout your journey. We'd love to hear your experiences, share your licensure journey, or questions in the comments. Don't forget to subscribe to our channel for more insights and updates on medical careers in Canada. Best of luck as you pursue your path to success.